We are live. Good evening. This is Dennis Wong from Sin Pharmacy and Sin Nutrition in Winnipeg. I am very, very excited tonight to have Dr. Hal Blattman on my Facebook Live tonight. He is one of the leading pain specialists that trained me and one of the mentor in the pain area. I've learned about pain from him back in 2006 when I first time met him, and that changed actually my understanding of pain. So I'm happy to have you here, Dr. Blattman.
Thank you so much. It is a pleasure to be here, and it's wonderful to see you again.
I know we haven't. I was just looking through the photo and stuff, and I have not seen you. Last time I saw you was in 2015.
Yeah,
that was a while back. We were having dinner at Maui.
Yes,
and that was
the last time I was there too.
Yeah, me too. So that was great. So tonight, we want to talk a bit more about pain, so that there's many people out there having issue with pain. Either pain itself is having a problem in their life, or affecting their wellness and functioning, or the medication itself. And I know that you have a little bit different way of looking at the pain, etc. So can you, tell me a little bit about what's causing the pain from your point of view and from, your understanding?
Yes, I'd like to do that. But first, let's just chat for a minute about the basic philosophy of how the world looks at pain. You're familiar also. If someone has pain, it comes from an injury. And if that pain is still there 3-6 months, magic number later, it magically turns into chronic pain, and now you can never make it go away, right?
Absolutely.
And now you have to make the brain not work, you have to kill the nerve, you have to interrupt the signal, and that's what we're taught, and that's what our patients are going through. But fortunately, that's not our reality. Our reality is, yes, pain comes from injury, but there the chain differs. The person who's in pain from an injury will continue to experience some evolution of that pain. And if you've had pain for 15 years, it's not quite the same in most cases.
Right.
You'll continue to experience some evolution of that pain until your biology can heal from that injury, no matter how long it takes. And just for people to know that you can get out of pain, that's the first thing we really want to get across. This thing about chronic pain not going away, that's only because we are not taught how to look at pain in a way that works to help it go away.
Right.
So when we look at pain and how it works, I've narrowed it down to 5 rules. It's hard to find that on the screen. And I made them up. That's how I know there's 5. And rule number 1 is, you cannot believe the pain comes from where you feel it. Your headache doesn't come from your head. The pain in your left arm could be your heart attack. And the pain in your knee joint doesn't even come from your joint. Some of it might, but most of it doesn't. Just ask your friends who've had their joint replaced and it still hurts and there's no joint there.
Right, absolutely. After I learned these things from you, one of the first patients that I ended up working with was a post-breast cancer surgery patient. And she had this excruciating pain on the side of her body, but there was no surgery at all done there. And to the point that she couldn't function at all anymore, until I had a chance to, feel it and found the problem and injury. So that was really, really interesting. I was so excited to, be able to figure that out from what I've learned.
And we'll get to that in a piece of that in just a second. You said a key word, feel.
Yeah.
So that'll be number 3. So rule number 2, and this is really contrary to everything we were taught, and that is, our brain can't tell the difference between numbness, tingling, burning, itch, tickle, sharp, dull, achy, stabbing, and even sexual arousal comes from the same part of our nervous system. So when you go to the doctor and you talk about, well, it burns and it here and it's numb there and it hurts and aches and stabbing, none of that matters. And we were taught that difference is diagnostic and gives us a clue as to the answer, and it really doesn't.
Right.
So rule number 3 is your rule of feel. When we examine your body, part of it is to make sure that what I feel on my side of your skin matches what you feel on your side. But the only thing you can believe, you got MRI scans, the data's all there, but connecting it to your pain, the only thing you can believe is that where you are specifically tender, millimeter by millimeter, represents either where the fascia that holds you together and goes through your muscles is kinked and tied in a knot, or where it attaches to you and holds you together and you've injured it. And we can talk about, as soon as we get through the rules, how you can feel that on yourself.
Right.
And rule number 4 is, as we examine you together that way, and it's you and me examining you, it's not just me, the places where you are most tender represent the kinks and the injuries through your lifetime that are responsible for causing most of the pain that you're most conscious of.
Right.
And number 5, and this blows me away, with maybe 90%, with a lot of accuracy, with a lot of success, as soon as you unkink the strings that go through your muscle, the fascia cords that go through your muscle, and if you need to, heal how you anchor and hold together so it's strong enough when you pull, as soon as you do that, the pain you thought you had will go away. And really, that's what you need to do. So to the extent that any of your treatment works, whether it's chiropractic, whether it's a massage, whether it's cupping and acupuncture, to the extent that your treatment gets you out of pain, it helps your fascia unkink and heal from the injuries you had a long time ago. And if what you're doing doesn't pop you out of the pain that fast, there are things that are in the way, or that treatment isn't big enough for what you need. And it's amazing how quickly you can get out of pain.
Absolutely. Like I said, since I've learned this, techniques and how to find the pain and the kink, I'm being able to work at myself and my family. And actually, there's one point I had actually pediatric psychiatrist actually contacted me from hospital because he had whole ward full of teenager girl with a severe migraine headache, and they couldn't do anything until I work with them and find that, where the injury is coming from, type of thing, and where the pain's coming from, and being able to release the kink, then we were able to discharge almost all the young lady from the hospital. And that was exciting stuff. So
an example of how you can find it on yourself while you're watching the screen. There's a muscle in your neck, runs right along here and down to the front, and it's about this big around. And you can reach your hand around it, your thumb and your index finger. You can get quite a big bite of that. And you can appreciate that there's cords and ropes inside this muscle that are unexpectedly tender, right?
Yeah, absolutely.
And so these are the kinks in the strings, and where those kinks are tightest, that's where those strings and cords are most tender. So let's find the injury now. Come down to your collarbone, and don't push on the front of it. Push in on your neck, and then push down on your collarbone. And toward the middle, you'll feel some irregularities, some little lumpy areas that are also surprisingly tender, aren't they?
Yes.
This is the injury that allows these kinks to happen. And maybe it goes all the way back to nursery school, when one of your classmates didn't like the color of your lunchbox, or maybe something you said, and right before morning recess comes up behind you and shoves you to the ground, snapping your head back and tearing where these cords anchor on your collarbone. And when the string snaps, the strings inside the muscle twist into this knot that makes this rope happen. And then, this is fascinating. It's going to take me just a second to turn to the right place, but you'll remember, Dennis, when I first showed you, this is what we learned on.
Oh, absolutely. That's still my reference chart. When I see patient with the pain, that chart come out.
So these are the kinks. Here you can recognize as one end of the injury. Here you can recognize the other end of the injury, and then the migraine that comes from this.
Right.
Well, you have tight muscles everywhere in your body. And the ones that are tightest and most tender and the fascia that's most injured through your lifetime is where your pain comes from. And
Absolutely.
what you need to learn, just like you said, is how do you unkink this? And you're able to do that with your hands, aren't you?
Yeah, absolutely. It's been fantastic. It's amazing.
So what we'd like to do is change medicine. And it's really slow to teach this to doctors. We can
Yeah.
teach a small group at a time. They can go and teach a lot of people. But what if people could learn this themselves the same way we teach it in the office? I had a woman come and see me for foot pain. She lives hours away by plane. We did this all by Zoom. I examined her by her touching her body and me showing her where. We found out where her legs were tender, where her feet were tender. She had 20 years of foot pain, lives close enough to New York to have all of that fine medical care at her disposal, had done several theories and working things with insoles, never had any surgery, but 20 years of pain. Well, I taught her what to do, showed her what to do, just like we're going to do in this workshop we're going to talk about. And I spoke to her 3 weeks later, and here's her story. She did everything I told her. She changed her diet. She worked on her body. And about 2 weeks after, most of her pain was gone. And she thought, you know what? I'll go on a hike with my friends. And this is a person who can't sit before she saw me for more than 15 minutes without putting her foot on the ground. It took an hour and a half to get to the hike. She was still okay. She had to pack more and carry more than she thought, so there was more weight on her feet. And the hike was longer to get to where they wanted and back to the car than she expected. So by the time she got back, she had a lot of pain in her feet. And she went to work in the back seat and did all the things we showed her, because while she's walking and doing all that work, she kinks up again and her pain comes back. And she was able to sit in the back seat and in 15 minutes make all that pain go away. And she was thinking at that visit that she'd be able to run again.
It's amazing stories, and I have the same thing. 6 weeks ago, I was working with this young lady. She's about 30 something, and she came to me for the migraine. And she said she's been having migraine for 20 years, and nothing works. She used all these different migraine medications. She even got Botox injection, and still migraine wasn't going away. So we started the trigger point on the neck and back of the head type of thing, depends on where, using the chart. And at the same time, I'm glad you mentioned that, modifying the food. That's what I told her to do. You need to modify what you're eating, because that may be contributing. And then supporting the detox system and other supplement along with it. And within 2 days, her migraine totally stopped.
Right.
Her migraine came back when she ate something that she was eliminated, and she knew it right away. So it's, when you can find that right injury and work it, not just one way, but multiple, because our body is complex.
And it's usually not one injury.
No.
You got injured many ways. So when you have this pain come into your head, it's not just this muscle. It's any of this
Right.
or this
Shoulder,
or your
yeah.
upper back. So any place, and how do you find it out? It's rule number 4.
Yeah.
You can only believe where you're tender, and the things that are most tender generate the pain, and you need to make them less tender. And we teach people how to do that.
Absolutely. When you said, you teach your patient how to treat themselves, I've actually taught my 15-year-old, he played basketball competitively. So I've actually trained him to find these tender points at the game, saying, okay, do you know how to find them? And he'll find them, he'll massage them. And, 10, 15 minutes, he's better. So I'm excited about this workshop that you're going to be having. So can you tell us a little bit more about the workshop that's coming up?
Yes. This is going to happen on February 6th. It's all online. You sign up. You have it streamed to your device. It's live. You can ask questions as we go. We're going to start at 9 o'clock in the morning Eastern time. It's New York time. And go till 4 o'clock in the afternoon with an hour break for lunch. So this is a real education. If you miss part of it, fall asleep for part of it, or can't do all of it, You'll be able to watch the recording as many times as you need to. You're already registered.
Wow.
And so we're going to spend the first hour talking about anatomy, real science of fascia that your doctor was never taught. How do you understand it? How do you look at pain through an entirely different lens that says, yeah, this stuff can
Right.
go away?
Yeah.
And then we're going to cover, and after lunch, we can't talk about this before lunch. You remember this. We're going to talk about food you don't want to eat. And there's a universal list. And whatever you're doing for your diet, the extent to which the diet you name, whether it's Mideastern or Paleo or Whole30 or whatever the name is, to the extent that it works, it's minding this what we call do not eat list, which we think is pretty universal to our species. So we're going to go over that after lunch and the science of how food causes this inflammatory pain. And you know, a teeny amount can cause you pain for 3 or 4 or more weeks.
Absolutely. I remember the first time when I met you at the training after lunch, what you said was, choose your poison wisely. I still remember to this day.
Very, very, very true. There's some things that everybody wants to eat or drink that you know isn't good for you, but you need to choose it wisely. And you were speaking about that person who had the headache and then they ate the food, the headache came back.
Yeah.
I liken it to your body, when your mother told you not to do something and you did it anyway. If it was the right mother for you, maybe you got smacked upside the head and sent to your room. Well, that headache is your person being smacked upside the head and sent to your room because your body asked you not to ever do that again, and you did it anyway.
Yeah. Oh, absolutely. She actually told me that, headache came back, and I said, did you eat something? And she said, yes. I know I wasn't supposed to eat that, and I will never touch it again.
Exactly. If that's all I have to do to never have a migraine ever again, I'm going to figure that out.
Oh, yeah, absolutely. Yeah. So
during the day, our coursework, besides those two, major pieces, because if you don't understand that and you don't get that right, it's really a struggle.
Right.
We're going to cover headache, neck and shoulder pain, lower back pain, carpal tunnel syndrome, leg cramps, and foot pain. And we're going to cover that through the day. We have a live example in our studio in Cincinnati that are taking this live. You'll be able to see how they learn it. You'll be able to translate that for your use at home. Everything will have live demonstration. You'll have an understanding of how your body's put together and what you need to do with your body to get it out of pain. And there was a person in my office the other day, and she was talking to me about integrative pain care, and she asked me about music therapy and other things like that, which we all know are really helpful. And I said to her, well, we don't really do much of that here because those techniques are all about teaching people how to cope. And the conversation should not be about coping. The conversation we like to have is, how do you just make this stuff go away?
Right. Healing is the key to it. Absolutely. I'm actually went and looked at the program on your site, and when I saw that, I'm like, I'm going to take it again because that will be my refresher. So I will definitely see you on February 6th.
Awesome. There's some new information that we didn't have in the early 2000s, so it's really nice.
Absolutely, yeah, and that's what I'm looking forward to because my first training with you was back in 2006, and then in between there, we spoke at the conference together a couple of times, and I learned some new stuff. I remember in Toronto when you came up, that was a few years back now, and at the dinner you were talking to other lady and trying to treat the plantar fasciitis for her, and I'm like, I never learned that one before, So every time I see you, I learn something new and exciting. So I'm looking forward to this February 6th seminar.
Let me also come back and say, I remember when we were in Maui having dinner, I was almost taking notes from the things that you were saying. Because every time I get together with you, I learn so much. And It's one thing after another.
It's the great thing because, we both have now so much information that sometimes we don't think about it. And so always enriching to have an dinner together or meal together and discuss and talk and share ideas.
And we've never stopped learning,
No, absolutely not. Yeah.
25 or 30-year ride of 10 hours a week or more, reading and learning, and a hunger for figuring it out. And there's so many places to figure it out.
There's more and more stuff that coming out, which is wonderful because, at the end of the day, then we can do more and help more patients with all these new information that coming out. So I'm really excited. The last word from you before we sign off.
So we really want to change medicine. We want to put this education in the hands of the people who need it, because you can learn to work on your own body and make your own pain go away, and then go back to the doctor for the parts you can't do. There's so much you can do, and there's so much that you can make go away. Most people who have chronic pain, at least 40% of their pain comes from their food. If you just change that much, you make a big difference. If you learn how to work on your body on top of that and unkink your strings, as soon as you unkink them while you're in the seminar, you will already notice a difference in parts of your body that are ready to let go.
Absolutely. Thank you very much for coming on the Facebook Live with me. Like I said, I will definitely will be on that seminar so I can learn some new stuff, some refresher for myself. And anybody that watching the Facebook Live, if you know somebody have some pain issue that, chronic or otherwise, I absolutely encourage you to attend this seminar. It's gonna be life-changing.
Just look us up on www.blattmanhealthandwellness.com. I'll get my head out of the way so you can see this. www.blattmanhealthandwellness.com, and you'll find registration information either right on the front page or under the events tab. And everything follows from there. You'll be registered, you'll get the course materials by email, and you'll have a live stream that you'll be able to ask questions and then be able to see it again later as many times as you need.
Absolutely. And also I will post the link again on my Facebook. And if you can find it, absolutely message me. I will send you to the messenger for the link so that you can easily register. Great talking to Dr. Blattman again.
You too.
I will be talking to you. We're going to have another, next Thursday, we're going to have another small chat on 7 o'clock Central Time again. So I'm looking forward to...
I'm going to be in Seattle next Thursday.
Oh, okay.
I finish at 4:00 p.m. my teaching at Bastyr University.
That's the 6 o'clock Central Time.
Yes.
So,
okay.
So you'll have an hour.
Fine.
I hope that,
It'll be perfect.
We'll be fine. Okay, great. I'm looking forward to talking to you again. Like I said, it's a pleasure and privilege every time I have to, had a chance to talk to you and learn more from you.
Thank you, Dennis. Wonderful to see you again. I'll look forward to Thursday. Bye now.
Absolutely. Bye now.